Welcome back at the Sofa Sessions, Module 3, and today we will be discussing your second assignment. The second assignment included starting with the patient journey, mapping the actors and mapping the phases on your patient journey. And I will start with the actors. So first I want to start with an example that we made also for total hip replacement, the patient experience journey. And these are all the actors we included in this journey, all the actors that play an important role in the journey, from most important to less important, starting with the patient, informal caregivers, GP of course, physiotherapist, surgeon, radiologist, anesthesiologist, people you will meet just before your surgery, and the nurse. Looking at your assignments, what we see is that some of you missed the informal caregivers. Well, I think this is a quite important actor in the patient's life. Some of you didn't. Physiotherapist is there, so orthopedic surgeon is there. So the rest is complete. Then we go to the phases.
Okay, well, if you look to the phases, I can see that you try to make it really complete. So that was really good to see. Well, if you look to the examples, like most of you start with feeling bad, and the first visit to the GP, the diagnosis, and then the referral to the hospital, for example. So those are quite good, but one tip about defining or how you describe these phases could be more generic. And I will also explain it with the example that we had. As you see, yeah, thank you. So we start with prevention to make it very complete. The prevention, and then the first complaints, you could say, and then consulting the GP after you experience the first complaints, and then the diagnosis, and it is also the referral to the hospital is included in this phase, and the surgeon decides to do the surgery. So the pre-operation phase is also included as a different phase, since there is a lot of information exchange in this part. And then you have the hospitalization itself, and then also surgery is included in this phase. The recovery rehabilitation phase, and then the aftermath is also included. So you see that is very complete time-oriented graph, and it gives you a nice overview of the different stages. And on the other hand, you have, of course, the actors, and what is important is to define the touch points, because you see that the patient has some kind of interaction with one of the stakeholders, with one of the actors in one of the phases. So it's good to define the interaction, and what we call is the touch points. So make it explicit what happened during the visit with the GP. Make it very specific in order to have good insights at the end. Did I miss?
No, I would like to add something about the actors. Because the assignment was as well to list the actors from most important to less important. Of course, you might have found out that it's quite difficult to make an estimation how important an actor is. So it depends on your assignment how you will rank your different actors. So if you want to focus on the general practitioner and the interaction with general practitioner and patient, of course that one is higher. At the same time, the orthopedic surgeon, the information an orthopedic surgeon is giving, is considered very important for patients, even if they have more interaction with the physiotherapist or general practitioner. So it can differ between different designers and different assignments. A last thing, so in this assignment you had to make the patient journey for the whole process of total hip replacement. So it's a journey of about 6 months, time-wise. But you can also think of smaller journeys, and I want to show you an example. This is a journey made by a graduate student, and this is a journey only of 12 minutes, and it's the journey that you have when you consult your surgeon. So between a consult between a patient and a orthopedic surgeon in this case. So there are 2 actors, the patient and the orthopedic specialist, and there are 5 phases, starting with acquaintance and concluding with saying goodbye. And here the student also mapped all the interactions, but also, and that is something that you will do next week, she mapped the emotions of the interaction that were, the emotions that are together with the interactions between patient and orthopedic surgeon. And here you see the differences in emotions. More about that next week.
Yeah, maybe also good to add that especially if you looked at we will work next week with the emotions, to collect quotes of the patients, of the actors, because then you really understand what happens in the interaction or the touch point, and so you can use the quote to more get the feeling of how the emotions were at that moment.
Thank you for watching again, and good luck with your assignment this week, and we will see you next week.
Bye.